Hi everyone, welcome. We're going to give a couple more minutes to wait for more participants to join the lecture. Thank you for being here today. Hi everyone, welcome to our PPCR talk. We're really honored to have today Claudia Suemoto. She took the program back in 2011, and after that she did a Master of Science in Epidemiology at Harvard TH Chan School of Public Health. She was also a visiting scientist in the Department of Global Health and Social and Behavioral Science. And we invite her because her great trajectory during all these years and all her development that she has created in Brazil, we know that all her experience can motivate and encourage you to keep growing in this pathway after the program. So welcome, Claudia. I will stop sharing right now so you can share it. And let me.
Yes. So good evening, everyone. Thank you so much for the invitation, Alma, Professor Fregni. It's a pleasure for me to be here. So today I'm going to talk a little bit about my trajectory, and it has been a while. I finished PPCR in 2011, so I have 9 years to tell you a little bit what I did after I finished my course in 2011. And I'm gonna tell you a little bit about my story so you can understand about my trajectory. It's not a linear trajectory, so I hope can give you some insights or some ideas about how to do your next move after PPCR. So let me put in full screen here. Yeah, great. So a little bit about myself. I'm an assistant professor of geriatrics at University of São Paulo Medical School here in Brazil. Uh, Before PPCR, I studied medicine at USP from 1995 to 2000. So it has been like 20 years that I finished my medical course. I did more 4 years of medical residence. I did internal medicine and then geriatrics, 2 years each. And after that, I tried to do like a clinical career. I moved to the countryside of São Paulo state and I had my practice there. But I missed my university and also my studies, and I decided to join the doctoral program at the University of São Paulo, and I finished my training in 2010. So all of these before I start my PPCR training. So PPCR, I'm part of the 2011 class. These are some photos from the 4-day course that at that time was in São Paulo. So PPCR for me was totally a turning point in my career. That's why I'm feel so grateful for the invitation to talk about how the course impact my scientific career, my academic career. So here you can see part of my working group. We're still friends until now. And the interesting part is that together with Professor Palacios, we implemented our group project. It was published in a journal, a high impact journal. It's called Brain Stimulation. And it was one of my first publications. Although I decided to do a doctoral program. During the program, I joined a group, a scientific group. I'm going to tell you a little bit about it, but it was not a very strong research group at the time that I joined. So during my whole doctoral program, I didn't have any publications. Even if I have done the doctoral program here in University of São Paulo, I did a lot of statistics and epidemiology courses, but I didn't feel confident with my training. That's why I joined the 2011 class of PPCR, and it was really, really helpful, not only for all the things that I learned regarding clinical trials, but also for more insights that I have regarding statistics that I didn't get during my doctoral training. And after PPCR, I also stay a little bit more like a teaching assistant from 2012 to 2014. But what happened is that after I finished PPCR in the end of 2011, I decided that I need to learn more, that I would like to understand more about advanced statistics and also epidemiology. And with Professor Fregni help, I joined Master in Epidemiology at Harvard School of Public Health. I did this in 2013. Has stayed there for 1 year. First as a master student. Here is a class at Harvard. During this training, it was really intense. I think you had before some talks of people that are already doing the MPH, the Master in Public Health. The program that I joined is a little bit different. It's a Master in Science, so it's supposed to be less practical and more into the methods. It was really, really good. I can talk to you later about that. I think was really a very right choice for me, because I could study more statistics and epidemiology than I would do if I do a regular MPH course. It was a wonderful time for me, because I think I changed a lot of my mindset while I was doing my training at Harvard, because there most of the people believe that you can make a difference, that you can do something novel and important for research. And I have many collaborations that I still maintain while I'm here in Brazil, even after many years that I'm back. So that's my class in 2013. It was really not only good for me, but also for my family. I had my daughter and my mother there to help. It was really, really a good experience for both of them. And although I had a lot of classes in 2012, 2013, during the academic year of 2013, I learned a lot of things regarding advanced statistics, but still, I thought at that time during that year that I did a lot of homework, that I did a lot of tests, but I didn't have an opportunity to join a research group. So I decided to stay 2 more years at HSPH doing a postdoctoral fellowship. And it was really, I think, a good time to be there. I was part-time there with a fellowship from Brazil. It was a good time for science at that time. They have the program that's called Science Without Borders. And I got a fellowship to stay 2 more years. And I think it was really important for me to have a different experience. I get out of the classroom and I really did wonderful research. And I was a mentee of Professor Godard-Dany. Professor Godard-Dany is from the Department of Global Health and Population. And at the time that I was there, he was doing really advanced prediction models for cardiovascular events. And I asked him if he could teach me how to do the same methods to build, to develop, and validate a model for mortality in older people. And during that time, I could really work with big data. Like we put together data from 5 different cohorts and develop a prediction model for mortality using data from more than 35,000 people. And besides being able to do advanced statistic methods, was really good for me to still stay in contact with wonderful people. And I think I brought this example here because as a side activity, one day, one of my friends of Harvard here, we have him here, it's Kazuki Yoshida. He said to me, Claudia, don't you want to go this weekend to try a hackathon at MIT, the Massachusetts Institute of Technology? And we went there and we proposed to develop a prediction model for older adults, but this time in the ICU settings, in intensive care unit setting. And in the end, we won the hackathon. Was the most amazing thing to win a hackathon in MIT. So there's a lot of things that were really important for me besides classes and doing research. All the environment was really important for me to change the way that I see research and the way that I do research when I come back to Brazil. So that's a little bit of my background. So I have to tell you now what I did in this last 5 years that I'm back to Brazil. Since middle of 2015, I've been living here again. I came back for the same university, and I was already a professor when I went there to do all of this. I did a master being a professor, and although I already had training here, the master and the postdoctoral training was something totally different that I was doing before. Before I had most clinical work. I know at that time I knew a lot about geriatrics, and my doctoral program, I was doing some studies with autopsy material. I'm going to show you later a little bit more about this. So since my doctoral program, I've been working with this group, the Biobanking for Aging Studies. And after I came back, besides continuing to be part of this group, nowadays I'm one of the coordinators of this biobank. I also joined another cohort study that is called ELSA Brazil, Brazilian Longitudinal Study of Adult Health. And I think most of my publications and my research has been with these two research groups, and I'm going to tell you a little bit about it so you can have an idea how I can apply what I learned during the PPCR and after during the period that I was at HSPH. So the Biobanking for Aging Studies started in 2004. So it has been like 14 years that we have been doing this work. And we are taking advantage of something that has been around for 100 years in my university. We have this general autopsy service in São Paulo that is responsible for natural deaths that we don't know the cause during life. So São Paulo city is among the most populated cities in the world. We have 14.7 million inhabitants, and per year around 86,000 people die in São Paulo. And because of most of the time they die in the middle of the street, or even if they die inside a hospital, but the healthcare professionals don't know what happened, what is the cause of death. Autopsy is mandatory in São Paulo. So the São Paulo Autopsy Service performs around 60% of all perform autopsies in around 6% of all deaths in the city. And we, since 2004, we've been asking participants of people that go to the autopsy service to donate the brain so we can study neurodegenerative diseases. Our main focus has been dementia. That's what I've been doing since my doctoral program, and I continue to do since now. And it has been really something that has been calling like international attention, because we have a large collection. We have the largest collections of brains in Latin America. We have 1,200 brains totally analyzed nowadays. And besides that, our brains had a lot of people that don't have a history of dementia during life. They have normal brain, normal cognition when they die. And this is a little bit of different from other brain banks, because most of the brain banks relies on donation of people that have already the disease, so they don't have a lot of controls. And in all these brains, we have performed a full neuropathological evaluation. We see evidence of Alzheimer's disease. There are these lesions here, neuritic plaques and neurofibrillary tangles. And we also investigate vascular disease and other more rare cases of dementia. And one thing that we could contribute, I'm going to give you like 2 examples of what I have been doing so for you to understand. We know that Alzheimer's disease is the most frequent cause of dementia worldwide, but usually people say, oh, it's around 60 to 80% of the cases are Alzheimer's disease. And here in Brazil, at least, is a little bit different. Alzheimer's disease is still the most frequent cause, being responsible for around half of the dementia causes. But vascular dementia is responsible for 35% of the cause. And this is really important because vascular risk factors can be modified, and it can change the chance of person to have dementia or not if you control the cardiovascular risk factors. So this is something that seems to be very unique to developing countries, and we didn't have an evidence of this before our study. And this is one of the studies that has been published with this data in a high impact journal. It has been really important for the dementia research in Latin America. Other things that we do besides collecting brains, we have been collecting a lot of arteries. This is some pictures of the carotid arteries. And it's really good because usually we have some clinical work showing an association between dementia and an increase atherosclerosis in carotid arteries. Although they are doing this study with in vivo in patients, so they're doing using ultrasound. And we could, using the autopsy material, really measure the size of the plaques, for example, here, right? So we are doing morphometric studies, and nowadays we're really measuring the type of the composition of the plaques. That is something that we could not do using imaging study. And with this material, it could prove that having a large obstruction, mainly in the left side, is associated with a higher risk of dementia. And after I came back, this was an invitation that I got while I was at Harvard. Professor Paulo Lotuf, I'm going to talk about him a little bit later and I talk about my mentors. He invited me to join the ELSA Brazil study. The ELSA Brazil study is the largest cohort in Brazil. We are following 15,000 people since 2008. So it has been like 10 years now. We already have 3 waves of the study. And I'm currently responsible for the cognitive part of the study. It is a huge study, as I said to you, and but most important, besides having a lot of participants that have been following for relatively long period, they have very cool measures. They have objective measures of the carotid arteries that I'm going to show to you. They have objective measures, for example, of coronary calcium. We are working right now with a sleep study that people use an actigraphy or a polygraphy for a period, so we can have really objective measures of sleep. So ELSA Brazil has a large sample, but also very cool measures that we have been using to understand better the risk factors for dementia in Brazil. So another example that talks a lot about my previous experience with neuropathology is that we have been using the ELSA Brazil cohort to investigate the association between carotid artery atherosclerosis and cognitive performance, this time using the ultrasound in 10,000 participants in this study. And we have been finding something very similar. We have found a worse performance in patients that have a worse degree of atherosclerosis. And I think my experience in both settings is important because I'm seeing the translation of the same findings in different stages of the disease, in different stages of the life of a person. So one thing that I've been showing to you is that I had good training that started with PPCR, but also I have access to very good data that is very unique in a lot of senses. And I think that's very helpful, so we can we are being able to do very good research questions. I learned this in the first lecture of PPCR, that you need finer research questions. And I think it's really important because when you come back to your country and you have to do research, one of the things that I thought before I do all this trajectory is that I have to do something that people have been doing, for example, in the United States. But since it was never done in Brazil, I could only replicate that and that would be fine. And that's not true. You still have to find finer research questions in a way that it has to be feasible, it has to be interesting and novel, of course, ethical and relevant, but interesting and novel, I think is something that we really need to think about it. And PPCR and also the period that I studied about, it was really important for me to understand. And I'm going to give you a little bit of what I think is interesting and novel, for at least regarding dementia in a developing country. The world wants to know what happens here. They need to know good research coming from Brazil, from India, from the rest of Latin America, from Russia, because most of the people nowadays, at least the older people, are aging in countries like ours. So it's not possible for us to only read a paper from Framingham Heart Study. That's a great study, but 99% of them are white people, and you want to with high education, and you want to translate these finds here to Brazil, where you have more the mixed race and also, unfortunately, lower education. These two things, race, ethnicity, and education, are huge risk factors for dementia, and you need to understand them, for example, in the context of different countries that have different, for example, socio-demographic profile. The last 5 years, most of my publications come from this time. I think if you want to have an academic career, you have to focus first in your paper. In your papers, you have to have good data, good questions, and then you have to finish until you publish. My first good paper I published during PPCR. And it was really important to know how to write. For a long time, I create excuse to myself, no, this is too difficult, I don't know how to do it. But then I learned that it's like a cake recipe. It's difficult, but you can learn because it's a very structured writing. You don't have to be Shakespeare to write well. So, and I think after you have a considerable number of publications, you need to start using this to get money, to have your own grant, to make your research questions possible. So I first started with my own doctoral data, the data that I developed during my doctoral program, but I use a lot of data that was collected for something else, so for someone else. But after you have some publications, you are able to get your own grants. Here in Brazil, granting funding is a little bit difficult. Nowadays, it's more difficult than ever, but it's still, I don't think we need to focus only on the bad part. It's still difficult. I currently, until now, I had 2 research grants from FAPESP, that is the regional funding agency here in São Paulo. But nowadays has been really difficult even to get money from them. So currently I got my first international research grant. This is from Alzheimer's Association in the United States. And I think you have to find ways of getting out of the bad situation. And nowadays there are a little few grants that you can run even if you are an international applicant. And for me, grant writing was very key. I started learning grant writing and, in fact, writing papers with Professor Donald Halstead that I met while I was at PPCR course. I don't know if he's still with you or not, but he's great. And after I joined the master program and also the postdoctoral program, I continued to study with him. And this time with the grant writing was really, really important. And besides having good data and have money to do research, it's really, really important to have good people around. And it's important to have people in different stages also. And I'm going to talk about 3 different stages that I see has very important to my academic career. First of all, mentors are essential. I put some photos here from people that really, really helped me in the past or is still helping me now. And I think maybe you already talked about this, so please correct me if I'm being repetitive. But I've been asking advice for all of them here. And I think it's really important to have more than one mentor because each of them provide me with different advice, being different aspects of my scientific career, or different aspects of my research, or even different aspects of my life, my family problems, my financial problems. They have been really friends. And it was really important to have them in my path because they were really, really helpful. The first person here, I'm going to talk very quick about them. Not going to be doing justice for the importance to me, but the first person here is Professor Carlos Pascalucci. He was my mentor during my doctoral program, and I always talk to him that it was really important for me to have him as my mentor, because I think if you have a bad mentor in the beginning of your career, you can totally give up about doing research. And Professor Pascalucci's approach about not seeing the rocks in the middle of the way was really important, because when we saw the rocks in the middle of the way, he really helped me to get the rocks out of it. So it was really, really important. And I could talk about all of them. Most of them are PIs from the studies that I joined, like Professor Paulo and Professor Isabella Bensignor. Some of them, like Professor Gadars Dani and Maria Glimmer, was my mentors while I was at Harvard. And I could not forget to talk about Professor Felipe Fregni. He was, I'm pretty sure, a mentor for all of you doing your PPCR course, but also he helped me really getting into the program of the Master of Epidemiology, give really good advice on my way. And I also like to stress the importance of Professor Marcia Castro. She's today the first Brazilian of getting tenure female professor at Harvard School of Public Health. She's the head of the Global Health Department. And she was the one that, in a casual talk, she introduced me Godard's. And after that, she talked to me about the data that is free available. You see, these people were in my way while I was training, and they really give me important advice that changed my academic career during my path. And nowadays, it's always important to have good collaborations. These are the pictures of people that have been working with me a lot in the last years. They are my friends. Most of them are my friends from the geriatrics division in University of São Paulo, but I also have another collaborators, neuropathologists, cardiologists, neuropsychologists. They're really pathologists. They're really helping me to do very multidisciplinary research. And I think sometimes it's interesting because they all have, some of them have only training in Brazil, they've never been abroad for a long time, but they really doing high impact research in their areas. And it's really good to have them with me. And most of my publications nowadays, it's because we've been working together in different aspects of the brain bank or the ELSA Brazil study. Another part of the collaboration that I think is really important is to form a research group. I have these are my current doctoral or master students. I have some postdoctoral students now too. Only one of them here in the picture finished her doctoral program this year. It has been really a pleasure to learn with them, to teach a little bit of what I learned before. And what I think it's most important when you come back and you try to form a research group to be more diverse as possible. So here we have some physicians, of course, some geriatricians, but I have pharmacists, I have neuropsychologists, nurses, and I have even a computer scientist that is really helpful to do something different. And I really try to make them work together. So I really believe that you put different people with different ideas together, you're gonna have a more rich research. And one thing that was priceless, and it was told by my mentor when I started, it said, oh, when you publish your first paper, it's gonna be really nice, but the real emotion, the really moving thing that you're gonna feel is that when your student does something great. And it's totally true. This is Daniela Faria. She was my master's student. She's currently my doctoral student. And here is she is holding her prize from the American Heart Association, has an early career investigator that's received last year. I was really proud, and I could not measure how much this made me happy. And also after we finished to publish her master after some months that she finished. So it was really, when you teach someone, when we start together, she didn't know how to analyze data. She didn't know how to perform all these analyses, like the bench analysis that she was doing regarding immunochemistry, immunohistochemistry. So it was really beautiful to see her growing. I'm very proud. This is much more worth than publishing a paper. When you see someone raising next to you, it's priceless. So one thing that I think it's also important is to participate in research community. Nowadays, dementia, it's really a hot topic. It's really a hot, very important problem worldwide. And I've been I'm doing my best to be part of this research community. I've been attending a lot of conferences. I think that's key, not only to show your work. Here's a presentation that I done last year showing the results of the Brain Bank during the Alzheimer's Association conference. But also, I think it's important to know people and try to collaborate. Currently, in one of these meetings, I met some people. We are doing research together, some people from the Washington University or even from the University of California, San Francisco. I've been collaborating because I've been meeting with them and trying to do research together. And it's really helpful. And besides that, I think this is another picture that I put here because I want to finish my talk about talking about inspiration. And one of the opportunities that I have is in 2017, I attend this conference, that's called Brazil Conference. They got a lot of people that are important here in my country to talk about science, education, politics in Brazil, to try to make Brazil a better place. I think that's in the end, the idea that we all have together. And in this conference, they invite me to join a talk with Professor Mayana Zatz. She's I think in my opinion, the most important female scientist here in Brazil. And also Professor Duila Mello. She works for NASA a little bit, and now she's in the US working there as a professor. And I think that's another thing that we have to have when you try an academic career. You have to find someone to inspire you, and being next to these two powerful scientists, female scientists, were really, really important to me. And to finish my talk, I would like to make a link with an honor that I get in 2016. Was definitely a turning point in my career. They have this prize, I don't know if you're aware, it's called For Women in Science. They have editions in several countries here in Brazil too. I was one of the winners in 2016. And this is kind of a funny story because I tried this when I finished my doctoral program. I didn't have a lot of publications at that time, so nothing happened in 2011 when I tried for the first time. And after I came back from the US, my university said, "Oh, Claudia, I think you should try this prize." I said, "Do you think so? I don't know." And I was like really out of time. The enrollment would be until the next day. And I said, let's try this time. And in the end, I get it. And I think was really important because it brings the scientific community, but also the general public, to the attention that we need to have gender equality in science. And for me, it was a turning point because they really invest a lot of time to show about your research, what you have been doing. And it was really helpful, not only for me to be more acknowledged in my own university, but also in other parts of Brazil. So it was really important. So that's what I would like to talk for today. We have some time to talk and answer the questions. Here we have my email and also my Twitter if you want to keep in touch. Let's do this. I'm going to stop share. And you can start talking, I think, if you have some thoughts.
Well, great, Claudia. Thank you for your talk and for your motivation words. We received a question in YouTube, and they were asking, well, why do you choose the Master in Epidemiology compared to the other master or programs that THN offers?
Yeah, that's a great question. And I think was when I applied, I have a vague idea what I wanted. I talked to Professor Frag and I said, "Oh, do the MPH, do the clinical effectiveness. It's really good. I have done that." And one of the persons that were in the picture that I show, it's a very famous epidemiologist here. And he said, "No, Claudia, try the epidemiology course because I think it's going to be really important for what you want." And what I want, and that's my answer to you, I really want to get a really strong background in biostatistics and epidemiology and study design. And when you choose these, you get away from a lot of courses that for me at that time was not that important. For example, there is a cost effectiveness course that I didn't do. There are some ethical course that I didn't do. And also when you choose the master in epidemiology, you do more difficult biostats and epidemiology courses. Compared to the MPH, they are more introductory. And when you do the master in epidemiology, they are more difficult. And I think for me, it was really, really important.
Great, thank you. And the other one was about funding. Was it challenging for you? Do you apply to any type of a scholarship or anything?
After I came back?
No, in the when doing the Master of Science.
Okay, so this is particular for Brazilians. I don't know if you know, if you get into HSPH, there is a specific fellowship for Brazilians that is provided by Jorge Paulo Lemann. It's called the Lemann Fellowship. So you have to apply for that, and it's really helpful. It covers part of your tuition. At the time that I went in 2012, it was not competitive. You get in, you get the fellowship. That's what I learned at that time. I don't know how it is now in 2020, but if you want to stay for the academic year, it's very possible.
Great, thank you. And then what was the most challenging things that you do during the Masters?
Wow, it's all very challenging. I don't know about your, for me, the Brazilian educational system, I cannot complain. I really have good opportunities during my academic life. I studied in a good university. I did a doctoral program that was considered good, but when you go there, I'm a physician and I applied for something that really required a strong mathematical background that I don't have. So it was challenging in this sense. Even when you apply for the master in EP, you have to get like good grades for mathematics. That's something that was away for years. So for me, the greatest challenge was to narrow the gap regarding my mathematic background. That is still not enough for most of the time. But I learned a lot, and I think for all the things that I've been doing, at least it's my point of view, it's my weakness. I always complain a lot that I'm not gonna do because it's very different. I don't have the training. I'm not exposed. So for me, I have to fight against these feelings that I'm not enough to do this because I don't have the required background. But in the end, you stop like making you smaller. It end up good, and I think nowadays I still don't have the background that I would like in mathematics. I'm still a physician, so what I try is to get in the group people that know more than me, and I think there are a lot of people that know more than me in this topic.
Great, thank you. And then I have a question here from Pablo. She said one question that I would like to do is, knowing the actual Brazil situation, what is your advice for those researchers who are beginning? Do you consider a better option out there or in Brazil?
Okay, that's a great question, Pablo. I'm gonna be 100% sincere. During the time that I was there, I considered to stay in the US and I considered to come back. And I think it's always a difficult decision. In my particular case, when I left Brazil, we were in a better situation than we are now. And I think it's really challenge when you come back to something that is worse than when you left. So that's something that I want you to consider regarding my answer. But here in Brazil, a lot of people say to me that there are many problems, and you know that it's really hard to get funding. But on the other hand, I think you really can make a difference. Here, if you are able to get a position, like I have a position now and I'm assistant professor, it's very stable. We don't have to fight for a grant to have a salary. That's a good point in some aspects. And also, I think we can do something that is meaningful for a lot of people, not only Brazilians. For when I was saying about dementia, most of what you know, it's based on Framingham, Eric, Mesa. There's like many highly educated Americans, white Americans. So what is the real association or the real impact in developing countries where most of the older people are living, where most of the people with dementia are living right now. So I think really can make a difference. And if you have good training, good data, and good people around, I think you're going to shine. And I think it's going to be a very pleasant path. Of course, there are problems, and I think there are different problems here, for example, than in the United States. But of course, it's in a way more, it's easier when you know your surrounds, you know where you can go to get things done. So there are some advantages. So answering your question straightforward, for now, I prefer to stay here.
Great, Claudia. And then thank you. We have a question for Salvatore. He's from Italy, and he's asking how many years do you need to build your research group in Brazil, or have you some particular formula in your opinion? Thank you for your great lecture.
Thank you, Salvatore. First of all, I'm always taking advantage of things that were already there. I started in this research group. The Biobank has a student, and now I coordinate the bank, but it was my students I have now in the last 5 years, and it's something that we are been building together, I think most in the last 5 years. But all the data that I talked to you, they were already there before I came here, right? The Brain Bank, I helped to build since 2005, I'm with them. But for example, the ELSA Brazil was already there. I was invited to join. So I think there are a lot of good coincidences in my path. And I think the whole secret is to be open to new opportunities, to new good opportunities. And also, I would like to say that for my research group, I'm trying to, some of them, like Daniela that I showed to you the example, she's doing cardiovascular research that I kind of did in the beginning of my career, but that's not my main focus. So I would like her, for example, to have her own research group. That's always what I'm trying to build here. And if there is some particular formula, I think there is, each case is it's a different case, but also know what you already have and build it from there. I never start something from scratch. That's my experience. And one thing that I would like to add, you can see that I'm not too young. I finished medical school in 2000. So it has been 20 years, and I stayed like 80 years of my after my graduation being most a clinician, and I changed my way of doing things in the last 10 years, and that's was really important for me. I think there is another question from Damien saying that.
Yeah. Yes, Damien.
Yeah.
I just graduated.
I think you, at least for me, you're frozen. You want me to read the question?
Will be your advice when writing to the PIs?
Yeah, so I'm gonna tell you my experience that I think is not the most common one. So I did this master in epidemiology. It's usually a 2-year program, but because I'm a physician, I did in 1 year. It's possible if you have a doctoral program before, you can do it in 1 year. So during this year, you're not, they don't want you to do any thesis. This makes the whole work very easy because you just have to attend class and do the exams. And so I didn't have a research project during the master, and that's, I think, is a big difference. When I tried to do the postdoctoral program, the PIs just arrived at my lab. It's really happened in a very funny way. I had two mentors for my postdoctoral training, so I'm going to tell you a little bit how it happened. So one of them is Maria Glimmer. She's one of the most influential epidemiologists in the dementia research. I'm very, very fortunate to her mentee during the time that I was there. And I attend her class. It's about methods in aging research. And at the end of the class, I just talked to her. Oh, I really loved your ideas and I would like to do research with you. That's how we started. And the other PI that I worked with was Godard's Denis. And I was like introducing myself to Marcia Castro, that is the Brazilian head of the Department of Global Health. I said, oh, I'm Claudia, nice to meet you. And then said, oh, I do malaria research. That is not really my thing, but I would like you to introduce you to my colleague here that do chronic disease research, Godard's, and then that's how I met him. So I never had to seek for a PI, but in the end, I think my general advice, if I have to try again from the scratch, I would try to reach people that are really doing something that is moving for me. So some kind of like high-end research in my area. Most of them answer.
Great, thank you, Claudia. And then we have a question from Juan Luis from Santo Domingo, the Dominican Republic. And he said, thank you very much for your motivation presentation. I was wondering, when can a doctor, in terms of academic preparation, start considering oneself as a scientist? As there may be doctors that may not be interested or skilled in research.
That's a good question, Juan. Thank you. That's something that it's my opinion. It's not something that you may disagree. I think when you are doing something new and that has impact in your area, even if it's for your surroundings, you can consider yourself a research scientist. When you are producing something that is adding a little brick in the all of knowledge, I think you can consider yourself a scientist. That's how I say.
Great. Thank you, Claudia. And then Pablo is asking you also from Manaus, Brazil. Another question. In Brazil, we know that doing research depends a lot of the government and public policies. Considering this aspect, do you know any private institute or opportunities for doing research in Brazil? Can you comment a bit about it?
Yeah, you're right. Most of our funding comes from the government, and this is totally out of reach right now. So here we have very few organizations that are not governmental funding. One of them is Serra Pileira, that is from the Itaú Banking. I tried that 3 years, then I cannot do anymore because after 10 years that you finish your doctoral program, you're not eligible anymore. So I complete 10 years this year, so I cannot do it anymore. So there are very few here that promotes research. But for example, Alzheimer's Association that I got the grant this year, it's a non-governmental funding agents, and they are open to international research. So I advise you to seek in your area what are the national and international institutions that are promoting research.
Great. Thank you, Claudia, for sharing that. And then Antonio Macedo, he's asking how much of your daily practice is actually dedicated to research versus clinical practice? Or do you think we can find some protected time for research and for being a PI of a study, for instance, without being a university professor?
So thank you, Antonio. Most of my time is research. I do like 20% of the time of clinical work, and that's my personal choice, and this has a huge impact in my salary. I tell you that it's a personal choice. If I was working as a physician, I would be in a much comfortable economic situation. But nowadays, it's an option that I did in my career, and I think that is really helpful that I'm a university professor, as you pointed out. For doing research without being a university professor, I have some friends that are doing this. They're working for big hospitals here in São Paulo, like Albert Einstein Hospital or heart hospital, HCOR. So I think it's possible, yes. And some of very good ones are hired by these hospitals because they want to improve their research. So I have a few friends that are doing that. I'm not doing that.
Great, thank you, Claudia. And then we don't have more questions right now. If anyone would like to open their mic or speak directly to Claudia, you're more than welcome to do it. Okay, then thank you for your time, Claudia. And any final remarks or comments to the participants?
Hi, may I say something?
Yeah, sure. Please go ahead.
Hi, this is Jonas. I'm a PPCR student from Brazil also. I'd like just to say that I have experience with Claudia. She's my mentor now in Brazil, and I'm very glad I'm doing with her. And I was very inspired by the PPCR, and I reached her, and now we're working together. And I hope I'm going to learn a lot with her, and I'm very grateful for that. Thanks, Professor.
Thank you, Jonas. I'm very, very happy to have you in my research group now. He's one of my postdoctoral students. And for me, it's in fact an honor. We've been training, Jonas is a little bit younger than me, I think a lot younger, but we have been the same division of geriatrics here. And it's really, I think for me, it's really touching to see the geriatrics research flourish here in my department. It's something very, very new. It's less than 10 years of history. You didn't have a very strong research group before. And this was something that really was not helpful for me in the beginning because I didn't have a role model. But at the same time, there's a lot of space for people to grow. Not only here at the University of São Paulo, but at different universities here in my country. Since we don't have a very strong background, we can create this background here. There is space for a lot of people to grow.
I just like to think I'm learning a lot with her. If you guys have the same opportunity, go for it.
Thank you.
Bye-bye.
Bye.
Thank you, Jonas, for your comment and for being here. And then...
Thank you, Alma. I'm very, very happy to be here. It was an honor. I hope I can help in some way. This course really changed my life. You see, it was really a turning point. I already had my MD, already had my PhD when I joined PPCR, and still I didn't have any publications. I was not part of a very strong research group, but before I joined PPCR, things just got better, better and better. And I'm in a very good spot right now. I'm very grateful. Thank you. And thank you for Professor Fregni too.
Thank you, Claudia. It was a pleasure to have you today. And Professor Fregni is also sending you his regard. He joined before and he wrote to you, welcome back. And he was so happy to have you here. And thank you all for joining and have a nice evening.
Thank you. Thank you, Alma. Thank you, Claudia.
Thank you. Have a good night.
Good night.
Thank you. Good night.